Welcome back to the Front Page Saturday Town Hall Edition. We are talking about the science of COVID, the latest on testing, on, cures, on what the virus really is, prevention, all of your questions, 520-KJLH, 520-5554. All you have to do is add your area code and you're golden. I want to thank our sponsors, Council President Emeritus Herb Wesson, the City of Los Angeles, Community Build, the Independent Professionals Association at indiework.org, and the supervisor for the 2nd District, Mark Ridley Thomas, who is our latest sponsor. Now, this is meant to be bringing you the latest news and information as we deal with this pandemic. And so this is your opportunity to ask any questions that you have or clear up any misconceptions or rumors that you're hearing. Dr. Nkiruka Emeagwali M.D. is with us. She is, among other things, an intensive care doctor. She's a physician and a scientist with a focus on viruses. Dr. Harry E. Taylor, he is a Morehouse man, but also a Ph.D. in molecular biology and genetics with an emphasis in immunology. And, we're talking about testing when we left off. I think this is one of the biggest misconceptions about testing and the whole issue of contact tracing. I know a lot of people are, worried about testing. And then we hear, in many cases, it takes a long, long time to get those tests back. I think, Dr. Taylor, you did a great job in helping us understand, the difference between the various tests. But what will it take? I mean, Dr. Emeagwali, to get to the point where this is actually getting us to be able to safely lift some of these restrictions?
So I completely agree with Dr. Taylor. I wanted to kind of just jump in and say a few things that I think might be helpful to the audience. First off, there are so many companies that have released different types of tests, so rapid tests and tests that take a lot longer to process. One of the reasons why we've been looking at different strategies for testing is because given the number of people that need to be tested worldwide, we know we're going to run out of reagents or the actual ingredients that we use to run the test. And so we're trying to figure out different modalities to test people so that we don't have only one way and we can actually spread the different reagents or different parts of the recipe that need to be put together in these machines or in these assays to run an effective test, okay? The one thing I want to stress is that when you go get a test, either a free test, I know they have in LA, throughout the country, or otherwise, you want to make sure you understand what kind of test you're getting because not all tests are equal. There are some tests that will have a higher likelihood of being positive if you really have the virus versus being positive if you don't have the virus. So that's called a false test, right? And so when you go to your test, or go to your physician or go to a lab, you want to ask them, well, how sensitive is this test? Because some tests are really, really good and some tests are not so good. And so that's the first thing. And these rapid antigen tests, are not as sensitive as the molecular tests that we do in the lab. They take a little bit longer. However,
so if I ask that question, what answer am I looking for? How sensitive is this test? Is there like a scale or something?
As close to 100% as possible. So you want to ask how sensitive and how specific. And so they'll give you a number. And so we know that the antigen tests, although they're fast, and we actually, like the fact that we can screen a bunch of people at a time and get the results right away. What I love is what's happening at the University of Arizona because, like I said, there are parts of entry in the body, different types of cells in our gut, like our stomach and our intestines, for example, that area that can allow coronavirus to get in. And so we know that we detected coronavirus in the stool. So when people go to the bathroom and defecate and they have coronavirus, we can find it in the stool. And so we see data now coming out of Arizona in the last week, University of Arizona, that as their students are going back to school, they're actually testing the sewage in different dormitories as a precursor to understand, could there be an outbreak in this dorm? And they actually found a situation where they detected the virus in the stool in this dorm. They isolated 2 students who had no symptoms, but were able to then quarantine somewhere else and prevent an outbreak from happening in that particular dorm. So
I read about that. I mean, they could do that through entire cities. I mean, that's pretty amazing.
And it's amazing.
We have some listeners, Front Page family, our Radio Free family on the phone with questions that I think are probably, questions that a lot of people are asking. So I want to go to the phones if you don't mind. I want to go to Shirley calling us from Hawthorne.
Good morning.
Shirley, good morning.
Hi.
Yes, I was wondering about the testing.
Hi, Shirley.
I hope I can get it right. I'm wondering, there are a lot of tests. So I'm wondering, how can the testing be approved so fast, and the actual, to cure the disease, the formula for the disease, why it's taking so long?
Got it, Shirley. Interesting question. She's feeling confused because there's all these different tests, but there's no cures or treatments, and it seems like, it doesn't make sense.
Well, I think kind of like what Dr. Taylor was saying earlier, it's important to know who has it, because we know that one person can give the virus to multiple people. And so the testing is really to get an idea of who has it, because some studies show us, Shirley, that up to 46% of people, almost 50% of people who have coronavirus will have zero symptoms. No fever, no cough, no difficulty breathing, no feeling tired. They will have no symptoms. And so how do you then get ahead of this besides doing massive testing? So in New York, we actually quickly, through the leadership, organized, free testing throughout the state. And we are doing up to 70 to 80,000 tests per day just to screen people and to figure out, who has this. We can then put them in isolation and prevent them from giving 2 to 3 people, that one person, the disease. And so we don't have a cure, but we know that if we find this early and we have interventions and treatments that we can give to patients who qualify for those treatments, then the likelihood of mortality or them having a bad event such as death from this can be improved.
Right, and it seems like I'm just going to Common Sense University here and thinking about AIDS and HIV. We were able to figure out and test and identify that the people were sick, and we still don't have a cure. So it maybe surely finding a test is to find out that you're sick is easier than finding a cure. I mean, I'm just guessing.
Well, let me chime in here. Do you guys hear me okay?
Yes, we hear you great.
Okay, so the first thing is identify. If you have a target, a virus threat, you have to understand that target or that threat before you can design an effective cure or therapy for it. And you have to be able to effectively identify individuals that are infected with it. So that's why there's such an emphasis on testing and identifying this virus so we can then design a specific therapeutic strategy. And so be clear about this, in that there are hundreds of labs, thousands of labs worldwide that are testing various therapeutic or various drugs to determine if they can stop this virus from replicating. So you mentioned AIDS and HIV earlier. You're right, we don't have an effective vaccine for it, but we have great therapeutics that, you look at Magic Johnson, our beloved Magic Johnson. He looks as healthy as you or I. And you have individuals now that are treated with AIDS therapies that allow them to live a normal life. And so 20 years ago, if you were diagnosed with HIV and AIDS, you were pretty much on your deathbed.
Right. So now here we are in a situation where we're hearing about a warp speed vaccine, and I think a lot of people are suspicious of it. I've seen polling where most Americans are saying they will not take it, which is problematic, of course. If you're trying to, control it through a vaccine, is that reasonable? I mean, given the fact that it seems like it's being rushed and.
Well, think about it like this. Think about computers 20 years ago. Think about your first Apple computer, and think about computers of today. Technology has advanced things, not only just for computers, but also for therapeutics. And so there are new vaccine strategies that have really expedited the process for their identification and their testing. And so that has helped things along quite a bit. But the FDA approval and safety process is still intact. So those vaccines that come through the pipeline still have to be demonstrated to be safe and effective before they are released to the public.
Yep.
Okay, let's go to Big Phil.
I'm sorry, just a comment. The NIH vaccine that we had heard of earlier, that one in particular had been in the works even before the pandemic. And so they really were looking at SARS, which is a type of family of viruses that coronavirus comes from. And they had been working on a vaccine and understanding a vaccine from a therapeutic and prevention standpoint from way before. So they had some data.
And just to be clear, you're saying the family of viruses, because we keep hearing that COVID-19 is a new disease, and a lot of people are suspicious because they see coronavirus on the back of the Lysol spray, and they think that means that this is a conspiracy.
Yeah, good point. So let me just kind of clarify that. So COVID stands for coronavirus. The 19 is because it was first identified in 2019, and we knew it was a coronavirus, or in the family of coronaviridea, of viruses. However, we didn't know which coronavirus was it similar to. Until 2020, we actually got the sequence from China. We saw that the sequence of the coronavirus, the COVID-19, quote unquote, which was named that, which we didn't know what it looked like, was most similar to SARS, which is one of the types of zoonotic coronaviruses. And so we were able to sequence the virus, and now we call it SARS coronavirus 2, because we know that that's a type of coronavirus from what we call the B lineage of the zoonotic, or the ones that affect animals. And so it was called COVID-19 before we knew what it was. But really, it's SARS-CoV-2 is the official name, because we know it looks like
Got it.
SARS virus from 2003.
Okay, let's go to Big Phil.
Just to chime in a bit about that, and just to make sure I couldn't.
Okay, I just really want to make sure we do have time to go to our callers, but go ahead, please.
Okay. Yep. So there are these coronavirus. There are some that are harmless, that cause no symptoms, but then there's a few of the family members. The one that was responsible for the 2003 SARS outbreak is a very close brother of the current virus, SARS-CoV-2, and these two guys, or gals, whatever you want to call them, are very, very lethal, or very infectious, and it can cause severe disease. So I'll let you take callers.
Big Phil from L.A., you're on. Go ahead, please.
Good morning. Creek didn't rise. Good morning, guys.
Good morning. How are you?
Hello?
Yeah, we hear you loud and clear. Go ahead, please.
I'm going to move very quickly. I'm kind of suspicious. You know, I'm protecting myself, taking vitamins and stuff. You know, the president talked the other day. Did you see all the dignitary officials didn't have no masks on? His whole family didn't have masks on. It makes me wonder, do they have some type of vaccine? All the people up there didn't have a mask on. That's kind of make me wonder about that. I know Herman Cain died because he didn't have a mask, but it makes me wonder about that. All right, guys, up and land. Take care. God bless.
Thank you, Big Phil. I mean, it is a logical reaction. You know, you see all these elected officials out there with no protection, no masks, and I grant you they were outdoors. But he's saying that makes him think they have a secret cure or a vaccine or something that the general public doesn't have.
That is a good point. Very good point. I'm going to address that. I'd like to mention first, think about Herman Cain, okay? Another Morehouse alum who's a strong Trump supporter. He got infected and he actually died, right?
Yeah.
One thing that is protecting the president, you see that all these individuals that come in contact with the president, no one's wearing masks. But you can only transmit the virus or get infected if you're in contact with someone that is positive. So they have access. Now, this is a big thing, is that they have access to frequent rapid testing, more so than the average individual has. And so everyone that comes in contact with the president is tested on spot. And if they are found to be positive, they're not allowed to come in contact with him. So those are people that are in his immediate circle. But now we think about some of these other large crowds, people are just being foolish. And they are likely to get infected if there are infected individuals among them.
There were many members of Congress, many members, of the Senate sitting in the Rose Garden. And, I think maybe they were all tested. It's possible. Like you said, they have the rapid testing, but I can certainly understand why Big Phil would be suspicious. And it is really sad.
The other thing is that it's much more difficult to transmit this virus outdoors with great ventilation than indoors. So it's a tragic event when you have large amounts of people indoors, poor ventilation. Under those circumstances, the virus is it's a lot easier to become infected under those conditions. Outside is a lot more difficult to get infected.
All right, I want to go to Angela. Oh, go ahead. I'm sorry.
I just want to kind of concur. I want to just really encourage the audience to really focus on understanding how this virus is transmitted, and then using that to empower yourself and protect you and your community from the virus. There is so much information that we know now that we did not know in March, and we absolutely have good data to support how it's transmitted, and that wearing masks, washing your hands for 20 seconds with soap and water, or using alcohol-based hand sanitizer with the right concentration of alcohol, and social distancing, all these things work. And we have lots of studies from across the world that show infection rates go down, hospitalizations go down when we implement these strategies. So look at all that data, just opposed to 1 or 2 nights where you see these things happening. And I want you to sort of use the science, which is evolving. We're learning more and more each day, so things do change, but there are certain patterns that have been persistent, and this is one of them.
Great. Angela from upstate New York, welcome.
Good morning. Thank you for the great conversation this morning. Question would be, there's lots of conflicting information about children and the impact of the virus on them. So I'd love for you to talk a little bit about, if my child's infected, what's the likelihood of that virus transmitting to me? And then with schools opening up, for children who are asymptomatic, are we really putting teachers at risk? So we have so many schools, some schools.
Right, and it's not just teachers. We get the gist of your question, Angela, and it's not just teachers that, you're also talking about bringing stuff back to their parents, their grandparents, especially, in African-American and Latino households, you have multiple generations living there. So, Angela's concerned about that, the kids, asymptomatic kids, carrying this around when we open schools.
Major issue, because it is clear now that kids that are asymptomatic, in other words, are not demonstrating any symptoms at all, can infect other individuals. And they can infect their grandmas, their parents, others around them, teachers, caregivers, and some of those individuals that get infected may not be as lucky as them, and they may be likely to develop severe symptoms to this virus. And that's the really intriguing thing about this virus. Kids, young individuals, for the most part, have mild symptoms, but there's many exceptions. Elderly individuals and those with things like diabetes are more likely to have severe symptoms and could potentially die from this virus. And so this is why when schools are reopening, kids are being encouraged to wear masks that are above, say, 3 or so, just to limit the transmission. And so you just have to be mindful. Just because an individual has no symptoms doesn't mean that you will also have no symptoms after getting this virus.
I don't know if you guys are parents, Dr. Emeagwali and Dr. Taylor, but when I talked to my mom, who's in a nursing home, on the phone, she said, you cannot keep kids away from each other. They hug each other, they hit each other, they roll around on the floor together. How can you reopen schools?
So I think, that's a great point. I work with different schools. I talk to parents, teachers, about this exact issue. And I really think it's, one, really important for the community and these schools to partner with clinicians and scientists as they're looking at these state guidelines to determine the best reopening strategy. The one thing I'll say is that there is a lot of information out there already. I mean, the American Academy of Pediatrics, for example, released really good guidelines for schools to implement. There are several other organizations that have really outlined.
But they changed their guidelines. First they said don't open, then they said do open. I mean, that
it
erodes public confidence
rate.
Too.
Yeah.
Right.
So it depends on the infection rate. And so it's not going to be a one-size-fits-all for every school district. It's going to really depend on the infection rate and how large the classes are, how the ventilation system is set up in that school system. Can they go outside for part of their day in warmer climates versus in climates that are colder and they don't have that access? There are a lot of factors, but I do want to encourage teachers that there's so many scientists and clinicians that have put together even calculators to really think about the risk with all these different variables. You know, how many teachers do you have? How large is your class size? How many immunocompromised kids do you have? All these different factors are taken into place in thinking about how safe it is for you to reopen, and is it possible to do a full in-person, or is a hybrid strategy or a remote strategy the safest at this time point? And so there is support there. It's not as easily disseminated. I'm not sure why to the private school system, but we have a list of resources to really help make more educated decisions, informed decisions for schools that are based on science. And we really encourage the school systems to seek out these resources. I'm happy to provide them offline, but there are things that we can look at. And we have data from Israel and other countries that have reopened. We know what worked for them and what didn't. We can utilize all this to help us out here in America.
Maria, calling us from New York City. Good morning.
Good morning, Dr. Taylor and Dr. Emeagwali.
Good morning.
Great job. I wanted you guys to talk a little bit about the impact of the virus in minority communities and why. Talk a little bit about the vaccine and why.
Got it.
Not fear the vaccine.
Okay, we just have we have a very short time left here, Maria. Those are great points. We touched a little bit on vaccines, but I think her point about the impact of on communities of color, the fact that these companies are having trouble getting people of color into their clinical trials, in what that means.
Absolutely.
Well, that's the thing with the many clinical trials is that there were people of color who are generally most at risk are usually less likely to sign up for these things. And that is really due to the long history of mistrust, distrust, and exploitation of those same communities. Just think about the Tuskegee experiment. And these experiences are so vivid in the memory of these communities. And so that's another major barrier. I think you're going to need another show to talk about this. But that's going to be a major limitation to fully addressing the COVID-19. Because if we do not enroll, if we are not involved in these trials, then there are certain drugs that don't work well in certain communities for various reasons. And we will not know that unless some of us are participating in some of these clinical trials.
Yeah, at the risk, and we have done those shows, and we'll keep doing them. At the risk of going off on a tangent, I do want to say that that's confusing because we're always told that the science is colorblind, and now we're hearing that if we Black and Latino people don't get in the studies, it might not work on us. That seems like a contradiction.
Well, science is colorblind, but the reality is that there are genetic differences between certain groups. And again, that's something that we can address later.
Yeah. And I just wanted to say hi to Dr. Maria Lima. She was someone who's mental in Dr. Taylor and I's training process at Meharry Medical College. And so thanks for calling in.
Excellent. All right, we just have a couple of minutes left here, and I want to know what you want to leave us with. What's the pressing thing that you wish you could say to our primarily African American and Latino listeners who are relying on us to bring them information? Do you want to start, Dr. Emeagwali?
Yes, thank you. So I really want to stress the importance of prevention. Like we know there is no cure. We have certain treatments that do work well and that we've seen in the clinical setting, but prevention is so key because like many viruses, our own immune system will help to try to clear it, but it's been challenging with coronavirus, especially in communities where there are increased amounts of pre-existing conditions, including obesity. And so hand washing for 20 seconds is really important because that really makes the virus wimpy in a sense. And so even if you have the virus on your hands, it's not going to be able to infect someone else as efficiently or effectively because the soap and the water literally disrupt the virus and makes it wimpy. So 20 seconds is really important for that to happen. Soap and water or ethanol-based, with at least 60% ethanol content hand sanitizer. 2, social distancing is really important. 6 feet apart, I limit the amount of time you spend with people. Definitely wear a mask. Cover your nose and your mouth. If you're traveling, please consider also wearing goggles or face shields to cover your eyes from contact. Remember, this virus just gets into surfaces, so it likes to get into the eyes, into the nose, or into the mouth, which is why we try to cover them. So wearing the mask is really, really important. And try to be outdoors as much as possible, because when you're outdoors, you have better ventilation. And if you're around the virus, that ventilation will help to decrease the amount of transmission. And remember to talk to your physician, because there is a lot of times things changing. So, for example, like you said, the FDA released some testing guidelines this week that they sort of quickly retracted and changed because physician groups were not in agreement with those guidelines in terms of how they should test. So please contact your doctors and find out what they think about these guidelines. Get them to weigh in so it can be as safe as possible. Up against the clocks. Sorry to rush you, Doctor. Dr. Taylor, how would you advise us as you leave?
I just want to sum up things. I agree with Dr. Emeagwali, and just to relay to your audience, there's a lot of misinformation out there. There are a lot of couch experts, Google and YouTube experts out there. The information you receive is only as reliable as a source. And so talk to your physicians if you have questions about some of these things. And the other thing is that you really have to utilize your voice by voting. The CDC, which now has eroded our trust, has had a more than 70 years illustrious history in fighting diseases here in America. You may ask yourself, why is it within the last year they have bumbled and fumbled through this epidemic? You sort of be mindful of that and think about that. And I'll just leave off there.
Well, Dr. Taylor and Dr. Emeagwali, thank you so much for the great information, and hopefully we'll get to talk with you again.
Thanks for the invitation.
It's my pleasure.
Take care and stay safe.
Continuing right after this, Radio Free 102.3 KJLH.